All right, good afternoon, everybody. Here's to a snowy Thursday. Here with Josh and Paul and a good friend, Andy Slavitt. Andy, you maybe remember, he ran CMS. They run Medicare and Medicaid under the Obama administration. And he's back with President Biden helping to lead the COVID task force with Jeff Zients. And I'm going to give you an update just for a minute, and then I'm really hopeful that Andy can give us a little perspective about what he sees here in the Connecticut, our region, and across the country. As you can see from the charts, the numbers are all trending in the right direction. And I'm not sugarcoating. It's good news. We've done a lot of tests. Positivity rate, 2%, 2.5% over the last 7 days, a trend line that is continuing. Hospitalizations down, lots of capacity at our hospitals. I think you remember that was a key metric in terms of reopening. Fatalities, 20 too many, but we were at about 44 a day just in January. So even that lagging indicator is showing some good news. Here's the vaccine update. Very quickly, Josh always loves to see where we stand next to our peers. Number 3 in terms of the number of people we're getting vaccinated, making sure that we leave no vaccines on the shelf. In case you're competitive, that's Alaska and New Mexico have got a few more, higher percentage of their people vaccinated. We've got about 14% of folks in Connecticut have had at least their first vaccine. Laggards are in terms of states are Georgia and Tennessee, Texas. Unfortunately, Texas is going to get hit now by the storm as well. If we have a 2.5% positivity rate, they're closer to 14% positivity. That's the number of people we have vaccinated. A lot of our 65 or 75 and above, that's slowing a little bit. We're going to have to work hard to make sure the rest of that cohort gets vaccinated, 68%. 65 to 74, which is the group we opened up about 10 days ago, that's going up pretty fast, 29%. And we're going to keep our foot on the accelerator, focusing on this age group. Why 65 and above? Because that's where 90% of the fatalities were. Managing the inventory to mitigate against weather disruptions. Look, there are disruptions. You look at Louisville. They're not used to snow there. Only 10% of the people were able to get in, and that's where the Moderna vaccine is distributed from. Fortunately, we've got almost all of our doses for this week, and so far so good. No cancellations are anticipated, but time will tell and track this online. A little shout out to some of our champion cities in terms of getting people vaccinated. Marlborough, Durham, Essex, Old Saybrook, Bethlehem. They're all north of 25% of their populations have gotten at least their first vaccine. And hats off to them. We're working hard on our, our cities where the vaccination rate can be as low as, 6 or 7%, a lot less. Some of the underserved population is doing a better job of getting the vaccine to them with trusted advocates, giving them the confidence to get vaccinated. Josh was telling me that Bridgeport is stepping it up. We've got a reverse calling out to all those seniors, saying press 2 if you want to get vaccinated, make it easier for them to get vaccinated. These are all priorities we've got to do to make sure that all of our populations get vaccinated. But given, 14% overall in some of our towns, double that percentage, probably in a week, I'd say, we're going to be able to make some announcements in terms of essential workers, because you're going to find that within a week, a lot of our towns are getting closer to the capacity, that 65 and over group. We want to make sure that we can continue the flow of people getting vaccinated, even in those spots that are most likely to have people vaccinated. Okay, the vaccination is accelerating in terms of numbers of people vaccinated. You can see it started slower. The yellow graph is the first dose. The blue is the second dose. Blue is catching up. If Andy Slavitt started around January 20th, I think you can see that purple line is trending up. That purple line is the 7-day average. And, gone from 15,000 to north of 20,000. And we're going to continue, hopefully, to hear that acceleration as time goes on. Andy can lend some insight into that. And finally, I just want to remind you that the vaccinations work. We were the first state in the country to get all of our folks in nursing homes vaccinated and a second vaccination. You know how hard we were hit and all of our neighboring states were hit in terms of complications and fatalities at our nursing home. We made a triple priority to make sure that our residents and nurses got vaccinated there. And if the number peaked in and around January 5th in terms of the number of folks in nursing homes who were detected with the COVID virus, it has gone from 483 to 30 in a little over a month. And that's a reminder: A, get your vaccination; B, it works and it is safe. And it's no great cause for celebration, but we are continuing to cautiously reopen and give you a sense that people wearing the mask, keeping the distance, getting vaccinated does pay some rewards. We've modestly made some changes, as you know, in terms of plans for major events in, starting on March 19th, weddings, birthdays, and the such with the caterers. We'd like to say we can now add on some of the sports that were considered more high risk by CDC and CIAC. That's cheerleading and dance can now be allowed as long as you're wearing the mask. I think you're going to have, clear guidance. We'll be able to do other sports, certainly outdoor sports like lacrosse, give you guidance on that very soon. Look, I used to love watching my kids play hockey and basketball, and I know that's been sort of limited over the last few months. So I think we're going to lift that cap to some degree, still erring on the side of caution. 25% of capacity, or up to 200 people, so you have a better chance to watch your kid in youth athletic sports. Colleges are making their own determinations in terms of what those limits are going to be. And starting March 1st, very soon, interstate athletic competitions, so we'll see a little more of that going forward. But I wanted to keep this brief just because Andy's only here for about 20 minutes. Andy Slavitt's been on the job for a little over a month, helping out Jeff Zients, helping out the COVID team, a great friend for all the governors. I can tell you that on a personal basis. And Andy, what's your perspective on Connecticut, New England, and across the country? How are things changing?
Well, thank you, Governor, and thank you for having me here. And look, I would say that while I know you're not celebrating, I do need the people in the state to know what a really remarkable job Connecticut's doing, you and your team, and the many people who have been part of this vaccination program. I recognize everybody is impatient. This could not go fast enough. But with the partnership that we have, as we've been able to ramp up supply of vaccines, and I'll talk about that in a moment, it is clear to me that as soon as we can get more vaccines to Connecticut, Connecticut's going to get them into people's arms. My philosophy here is pretty simple: more, better, faster. We need to get you more vaccines, and we have increased the allotment by 58% since the date of our inauguration. Better, that means that we need to get vaccines not just to more people, but to people in communities of need. You referenced this, Governor, and I'm so appreciative that you did. But doing a great job getting racial and ethnic minorities, people who are working on the front lines, people who are at high risk, people in long-term care facilities, that's better. And faster, that just speaks for itself. So here, since we've gotten here, we saw three problems. One was there weren't enough vaccines purchased by the federal government. We took care of that under the president's direction. Two, there weren't enough vaccinators. We essentially have created more vaccinators by allowing retired doctors and nurses, as well as FEMA and the military to do vaccinations, and creating more vaccination sites by building mobile sites, by putting more into community clinics and into retail pharmacies, and really just doing more to give you visibility, because We will have a shortage for the next period of months. It won't last forever, but during that shortage, the thing we can't do is have people hoarding vaccines because they don't know when more will come. And so what we've done is we've said we're going to promise you at least 3 weeks of visibility at all times, and we will only increase that amount of what we've committed and never go down. That way you can do the same thing with the people delivering vaccines. So we know everybody is anxious. We know people want these vaccines to come as soon as possible. And along with the state government in Connecticut, we are doing everything we can and pulling out every single stop to try to make that happen.
So what are the choke points in the supply chain? As you pointed out, thankfully, our supply is up 58+% in the last month. What do you think we can do over the next month or two?
Well, so look, our commitment is that by the end of March, we will have distributed, probably going into early April, if you take the time it takes to get into states, some 200 million vaccines. That's not counting anything from Johnson & Johnson, because even though you might say Johnson & Johnson's promising, and it is promising, the FDA is yet to meet on that. That'll happen in the course of the next week, so it could be even a little bit higher. But that to give you a sense, we've done about 55 million vaccines across the country here in the middle of February. So we see a continued ramp and continuing to increase. These are massive processes. As you said, they're enormously effective vaccines, but they're also very, very safe. And so making sure that we don't rush the process, we just expedite it as much as possible and get through all of the things that need to happen, from the raw materials where we have seen choke points. We have used the Defense Production Act to create more supply, to the fill and finish facilities where we have made sure that lines have been extended. And then we, of course, have FedEx and UPS, who are doing a great job getting the vaccines out to states and out to sites. And so each of these things has allowed us to accelerate. When I got here, we thought we would get vaccines out to the public by the end of September. We've since pulled that up to the end of July. And if Johnson & Johnson's approved and more things go our way, maybe we pull that up further. But we also know that surprises happen. If we know anything about this virus, whether it's the bad weather this week, whether it's new cases, and despite the reduction in cases that we've seen in Connecticut and other places, we shouldn't take too much solace yet. And so we are trying to be prepared for surprises. We're trying to underpromise and make sure to meet our commitments to you so that you can meet them in the state.
And Andy, last question, since I know your time is tight. In terms of surprises, how worried should we be about UK and South African variants?
So I think we should be short-term worried, long-term not so worried. By short-term worried, I mean we shouldn't take too much comfort that we're out of the woods because we see cases dropping. What happens with these variants is that they tend to grow before you can see how fast they're growing, because it starts from a very low number. If you put that graph back up of cases, you wouldn't see how quickly the cases might be growing. So what I urge people is, no matter what you're allowed to do, no matter what the governor and the team and the health commissioner say are allowable, continue to be cautious. Just because you can put 200 people in a room doesn't mean you need to put 200 people in a room. So continue to exercise caution, because we know that these things grow before we can see them. In terms of longer term, I feel quite confident that the vaccines we have are either set up today to address and meet these variants and defeat them, or in the cases where they are challenged, the pharma companies and the researchers and the scientists all know, that believe and tell me that they can be continuously updated. So there will be mutants, there will be variants, there are always curveballs coming with this pandemic, but science can beat them. They do need our help. We do need to continue, all of us, to stay vigilant until this thing gets defeated. I love seeing the 2% positive number in Connecticut. Not just you, Governor, but the entire state should be commended for that. That's an incredible achievement.
Well, thank you, Andy. And I got to tell you, it's great having a strong partner in the federal government as we wade through this. I see a light at the end of the tunnel. Now go tell Pfizer to produce more vaccines, will you? Thanks for your time here.
Thank you. And I just also would go back at you, the same thing, the relationship and the ability for us to reach each other. If you've got a problem, if you've got a challenge, 24/7, that's the most important thing. And so we're very appreciative of that, Governor.
See you soon, Andy. Thanks.
Take care.
News 8.
Governor, we've seen a lot of weather problems this week here in Connecticut, but across the country, which I know affects vaccines. What do people do if they are in line to get the second shot and it gets delayed by a truck? The weather and the truck gets held up.
We found a little bit of that in the last storm. I'll pass this to Josh, but he's given me some assurances that almost all of our doses for this week have arrived, so we don't anticipate any big delays, but there may be some small delays. Josh?
Yeah, our team at DPH has been tracking all of our shipments to all of our providers in Connecticut incredibly closely over the last several days. For the deliveries we're expecting this week, we've gotten most of them on the ground in Connecticut, so that's great news. We've gotten over 90,000 of the roughly 100,000 first and second doses delivered. Some may be delayed, as the governor mentioned. McKesson, who's the distributor for the Moderna vaccine, they're having significant challenges at their distribution plant in Louisville. Many states are dealing with significant impacts. Ours are fortunately more limited. We got most of our doses on the ground. And we're working with our providers where necessary to move vaccine around the state. We've talked before about our inventory management and the partnership we have with our providers who are so great at working together to loan doses from site to site as needed to try to avoid cancellations. And we've been working with a number of providers who've been impacted by those delays to help move doses around to them and make sure appointments don't get canceled. And that's our goal. And so far, we think we're doing very well there.
Thank you.
Fox 61.
Hi, Governor. Could you just please clarify regarding youth sports, what will be changing on March 1st? And then what should we expect to hear more about again in the coming days?
First of all, interstate competition will be allowed again. We had tried to limit that before because you had different infection rates across the region. But more importantly, friends and family can now go see a kid in youth sports, play hockey or basketball, up to 200 people in that facility, and a few more sports. Cheerleading, dance, for starters, are now available.
Okay, and then so far we've heard about venues and now youth sports. Anything else we should expect in terms of restrictions being loosened in the coming weeks? Maybe anything regarding dining?
I can tell you that Paul is working with the other chiefs of staff. We're thinking about travel restrictions. Those were put in place back when different parts of the country had very different infection rates. We tried to have a regional strategy, so we're taking a look at that. That'll probably be something discussed next week.
Thank you.
Channel 3 Eyewitness News.
Yes, Governor. President Biden said this week that the vaccine would be widely available by July to most Americans. Others, like Dr. Fauci, Dr. Gottlieb, they think it might be sooner. And considering how Connecticut has been leading the nation, when do you think it would be widely available here?
Well, I tried to pry Andy Slavitt on that a little bit because he's on the inside in terms of those negotiations. As you know, we've got 200 million doses on order from both, Moderna as well as Pfizer. Probably another 100 million coming on board from J&J. That'd be 500 million doses. That would get us a long way there. They're beginning to test on people 16 and under, so keep them in a separate cohort right now. I think we're going to be constrained, Matthew. I think I'll be constrained probably for another 6 weeks, 2 months. I'm hoping we get to some equilibrium then, but let's see.
And Mr. Slavitt did talk about some of the problems that he inherited when he took over with the Biden administration, saying that there was not enough vaccine, not enough administrators, and not enough sites. Here in Connecticut, we've seen there has not been enough vaccine to meet the demand. But have we had issues with the administrators or sites Have there been anything that have been a roadblock for us?
You know, we're setting up our sites now. We're working with FEMA and the Guard to help augment what we got to do. But our problem has not been the ability to get the vaccine distributed. We had an issue with getting more vaccines. And as you can see, the number of vaccines we have gotten and the rest of the country has gotten is up dramatically over the last month. But put your foot on the accelerator, guys. We need more, and people are ready to get vaccinated.
And my final one here, the 75 and older demographic, 68% have been vaccinated. And you kind of mentioned that this is a point of concern for you. Is there an access issue with this group, or is it a confidence issue?
I don't think so. I just think that in each of these cohorts or demographics, you have all the folks who are ready to get vaccinated, hitting the ground, anxious. And then the latter group, probably a little more hesitant, a little tougher to reach, don't feel quite the urgency. But from my point of view and from our team's point of view, we're going to still reach out to those 75 and above. They are the most at risk, and do what we can to make it easier for them to get vaccinated.
NBC Connecticut.
Good afternoon. You said we're pretty good. We've got most of our doses for this week, but I'm wondering, given the significant challenges you noted in Louisville, is the expectation that there could be an impact with the doses we're expecting next week?
We feeling okay, Josh?
It's a great question. The short answer is we don't know yet. We're watching it very carefully. We are concerned, both because of the McKesson distribution site, as well as our Pfizer doses come out of Michigan, which is also dealing with a lot of severe weather. So we're going to be watching that very closely. So far, no indications of delays for next week.
What do you have put in place in case that were to come to fruition?
Well, we'll cross that bridge when we get there. If we don't get doses, we don't get doses, and we'll have to work with providers to try to reschedule, as many other states around the country are doing right now, who weren't as fortunate this week as we were.
Okay. You've indicated in the last week or so that those with comorbidities may be included in the next vaccination group. And since then, we've gotten daily phone calls from people with questions about how they have to register. Will they need a doctor's note for proof? I know when you were asked about that last week, you said doctors would be reaching out to these folks who have underlying illnesses. But can you just kind of go over that again, just because they're obviously very anxious to get their appointments made?
No, I would be too, Kristen. What I can tell you is go to the CDC website. They have a very clear list of, quote, comorbidities, which should be prioritized alongside the essential workers. We're going to work off of that CDC list. And, Josh and Deirdre and I are going to roll out exactly how you'll be contacted, early next week.
Okay, and lastly, a quick budget question for you, Governor. You talked about the budget being all about priorities during the pandemic. Can you explain a bit of the rationale behind cutting funding to the diaper bank at a time when so many people are struggling?
I got to tell you, Kristen, I don't know about that, so let me take a look at it. Maybe there's some CARES Act money that supplements, but I just can't speak to that.
Okay, well, we'll circle back around with you. No.
Thank you for reminding me.
WTIC 1080 News.
Hi. What else have we learned about the South African variants? There was the one case, the person exposed in Connecticut, then shipped to New York for some other procedures. Any more details on that, and any other cases here?
Want to take that, Josh?
I don't have any additional details on that case at this time. No other cases to report.
The good news is there are no other cases to report. But we are testing. It's a complicated test, genomic testing, but we'll have probably better information, another round of testing by next week.
And something completely different. The Yard Goats released their schedule today, 60 home games starting in May. As you know, they sell out. What are you thinking those games are going to look like as far as in the crowd, and how many tickets are going to be available?
Look, I'm a Yards Goats fan, and I'd like to think that there's a way we can get fans into the seats with appropriate distancing. I have no crystal ball in terms of where we are in the infection rate in May, but I am optimistic we'll have fans in the seats.
The Associated Press.
Thanks, Max. Good afternoon. Governor, you just mentioned that you guys are going to follow the CDC guidelines. There are two lists on their website. There's one of people that are at increased risk, and the other one are people that might be at increased risk. The people that are at increased risk include people who have cancer, diabetes. The other, though, includes people with asthma, cystic fibrosis. Are you talking about both lists or just the first one?
Hey, Sue, give us a few more days to take a look at that. I know how anxious people are. I know CDC is sort of feeling their way on this as well. Obviously, those with the most acute risk should be prioritized. Seems logical to me anyway. And we're going to be working with the hospitals and the doctors and those that have a primary care physician to make sure they can reach out to people that are in that condition. But by the way, there are an awful lot of people in the underserved communities that don't necessarily have a doctor that they can rely upon. And it's going to be our obligation to reach out to them as well, especially those with pre-existing conditions, make sure they can get vaccinated.
So that really hasn't been determined yet, then, which list you're working off of?
Yeah, give us a few more days on that.
Also, Massachusetts Governor Charlie Baker said today he's considering sending the National Guard to southern states to collect their shipments of vaccine. I'm guessing you're not doing that, but I wanted to run it by you.
Haven't heard about that, Sue. Our guard's pretty busy.
Yeah, we were actually on the New England states were on the phone earlier today with some of our federal partners who are explaining the situation there. I'm not sure that that's going to do the trick. I think that there's a lot of work that needs to be done in the McKesson facilities to pick and pack the deliveries and get them on pallets and get them to the airports and so forth. So we were asking them and talking about anything we could possibly do, any help they needed, and they've got the federal resources all over it.
Okay. And Josh, you had mentioned on Tuesday that the state will be one of the 100 sites, the federal sites for vaccinations in Bridgeport possibly, but you said you might have more information. I wonder if you had any more details on that, and also the federal government's plans to work with the qualified health centers.
Sure. Well, FEMA was with members of our team in Bridgeport yesterday looking at our recommended site. It went well. I think we'll have announcements likely next week around that in terms of specific location. We also have applications in, as we mentioned before, to FEMA for smaller mobile teams as well that can go into smaller congregate settings and in communities, do smaller clinics. And then, yes, we were also talking with our federal partners about their federally qualified health center program. We've actually been distributing vaccine to our federally qualified health centers since the beginning for about 2 months now. So this will be an additional vaccine coming directly into them, which is great. And we'll be working together with our federal and local partners to make sure we're getting that out to the community as quickly as possible.
Great. Yeah, I just wanted to double check that. So that will be extra vaccine. That won't count toward our regular shipments.
That's correct.
Okay, great. Thanks so much.
Thank you.
The Waterbury Republican American.
You got me?
We got you. Paul, can you hear us? Paul, we will come back to you. Paul, we will come back to you later in the press conference. Hearst, Connecticut Media.
Hi, Governor. So I just want to clarify, the upcoming announcement next week, is that going to just involve essential workers, or are we going to hear more about those with medical conditions as well?
Both, Peter.
Thanks. And then are volunteers at vaccination sites being prioritized in any way for the vaccine? So specifically the people who are like registering people for the vaccine as they drive up or checking people in?
You know that, Josh?
Yes. People who are doing vaccinations, working vaccination sites, were eligible as part of Phase 1A.
So specifically the volunteers through...
Yes.
Gotcha. And then are there any additional workers in Phase 1B that the state's adding that normally would have been in 1C?
I don't think so. I think we're tracking pretty close with what the CDC is recommending.
All right, thank you.
CT News Junkie.
Governor, last year you issued an executive order suspending referendum votes on municipal budgets. Has that expired or is that still active?
I can't tell you whether it's expired, but I am told there may be a request for a referendum coming up, and Paul has said if it is requested, we'll be able to follow through an executive order allowing them to do that referendum.
As it deals with all of our executive orders, we always work with those entities that are most greatly impacted. In this case, it would be the municipalities and such. So upon receiving an official request from either municipalities or the groups of municipalities or association of municipalities and such, as it deals with this, we will look at it. Currently, the executive order that you mentioned is not current. It was only for that specific situation of referendums at that time, which was last year. But upon receiving a request, we will review it accordingly and take action if it's needed.
Okay. Some town officials have told me that they would like to allow residents to be able to cast absentee ballots in referendum votes. So why weren't those included in the original executive order that allowed absentee ballots in general and special elections?
Keep going, Paul.
Thanks, Governor. As I said, it was dealing with specific requests. So if there is a request in terms of utilizing absentee ballots as it deals with referendums, we look forward to those towns submitting a request directly to our office for the review of our legal counsel, and we'll work with the municipalities on those requests.
Well, I talked to town leaders today who said that they've been asking this question for 6 months. And some of them said even if you were to give them the green light right now, there wouldn't be time to implement it in the time they have left before their referendum votes. So I wonder if you might respond. What do you say to these town leaders who say that they have been trying to get guidance on this issue?
I will confirm with our staff on that. I know I haven't received anything. As you know, before the governor makes his final approval of executive orders, it passes my desk as well. So what I will say to that is that we'll, as soon after this press conference, I'll be following up with my staff accordingly. But I know that there's no executive order that we currently have in the books at this time.
So what was the thinking on allowing absentee voters or absentee ballots for this one group, this special election, general election group, but not for referendums? Why was that call made?
As I've stated, Hugh, every time we do anything is working with those local municipalities and such. So I can't go into every specific referendum situation and what occurred in the past. Each of them were individualized. But I can say overall, when it comes to how we approach our executive order power and the authority, is working with those constituencies thoroughly and making sure that we do thorough reviews of whether or not their requests are valid before the governor puts his signature on it.
Okay. Governor, I wonder if you might weigh in on the controversy in New York right now. Your friend Governor Cuomo, it seems like the legislature is considering revoking his emergency authority as a result of some nursing home numbers. What's your take on all that?
Look, my take is that, Andrew Cuomo and my neighboring governors have been great partners. This has been going on for about a year, Hugh. And, early on we were comparing notes because we had to, figure things out in many cases on our own. You mentioned nursing homes. If somebody is in a nursing home and then goes to a hospital and dies of COVID-related, is that a nursing home or a hospital fatality? I think you have 50 governors, each of whom handled that in slightly different ways. But, Andrew Cuomo in this case has been a good partner for the state of Connecticut, and we worked through a lot of things together over the last year.
All right, thanks.
Thanks.
The Waterbury Republican American.
Okay, I think I got it now. Getting back to Sue's question on comorbidities, when will people get a list? When is this going to come out? Because you've said several times now that you're going to base it on the CDC list. Not all of them. You raised concerns about smoking a few weeks back. So when might people get some definitive list of conditions?
Monday.
Okay. And this might be a question for Josh. When we're looking at the percentages of the vaccination coverage for 65 and 75, the age groups, are you able to break out how many of those individuals in each age group were vaccinated in a nursing home or congregate setting versus how many are living out independently in the community? Because we're getting some calls and emails from readers who are 65 to 74-year-olds who are just having the same kind of problems or waits in getting appointments, and they're just sort of skeptical when they hear those statistics.
Sure. Yeah. No, we do. So out of the almost 200,000 people who are 75 and above who've been vaccinated already, only about less than 20,000 of those are in nursing homes, so maybe 10% or so, to answer your question directly. But I think to your more general point that there are still people who are struggling to get appointments, and we certainly recognize that we acknowledged when we opened it up to 65 to 74-year-olds. That it would take several weeks. It's 350,000 people roughly in that age demographic in this state. And we're getting, 60, now going up to 70,000 first doses per week. So it was going to take some time for us to have enough vaccine in the state to get to everybody. So we appreciate that, some people are frustrated, still waiting for appointments. That's why we've got a little bit further to go before we're ready to get to the next phase.
And I was also looking at the vaccine rates using the SDI. It looks like the latest report, there's 10% initiated vaccines in the 75 and above, 75% and above. It's about 15% for the rest. Fully vaccinated, about 5% for the 75% and above SVI, and it's about 7% for the rest. Are you satisfied that we're making progress in evening out the sort of gaps that we've seen emerge in this early rollout of these two groups out in the community?
Well, I think we are making progress, but none of us are satisfied. I think we all are very clear that we have so much more work to do to make sure that vaccine is easily accessible to everyone who wants it, and that as many people want to take the vaccine when they are presented with the opportunity as possible in the state. So there, not a single meeting we have on vaccines in Connecticut doesn't include a focus on access and equity. It's going to be a long journey. We are making progress, but we have much more to do.
And Governor, at the beginning, and this will be the last one for me, Governor, at the beginning, you mentioned that you were going to leave the, I think, the attendance limit for colleges up to colleges and universities. Could you sort of elaborate a little bit on what's the plan versus, sort of youth sports?
The youth sports, Paul, as you know, we work with the CIAC. We said, given the much lower infection rates, we got the tournament season coming up. It's the end of the winter season. Wanted to make it a little easier for family, broader group to be able to go in and watch their kid play a sport and do that safely, wearing the masks, so 25% or 200. My understanding is the colleges all have sort of their own protocols, so they're going to, make up their minds in terms of what, if any, changes they want to make between now and the end of the winter season. Thereafter, it's spring, and we'll be outside, and I think a lot easier to watch a kid play.
Yeah, I'll just add, Paul, before you go, I'll just add, when the governor says in terms of their protocols, they work with DPH to provide an overview of what they would like to do, and DPH provides them guidance on whether or not that proposal is something that they should move forward with or not. So, for example, the University of Connecticut Go Huskies at Gamble Pavilion, Dave Benedict and his team there have been working with DPH, watching what's going on with the metrics, watching going on in the region, understanding what teams are coming in, and they'll make a request if whether or not they would like to have fans or things of that sort of a certain capacity. And so it's a collaborative working effort between DPH and the colleges and the universities. At this time, as you know from watching the UConn games, there hasn't been capacity as it deals with individuals attending the games. They have had family and limited to family of players to be able to attend the games. But that's what the governor was explaining in terms of the colleges having their protocol.
Okay, so there won't be a difference between private colleges and public colleges. It's not going to be a standard for UConn and the 4 regional universities?
But we ask for each of those colleges and universities, while they're working off of what we have put as a broader overview, what we have for event spectators and events as such, to work directly with DPH as it deals with their situation.
Okay, thanks very much. Sorry about the technical difficulties earlier.
The Hartford Courant.
Hey everybody, this is Emily Brindley from The Current. I'm also having my internet go in and out, so just let me know if you can't hear me or if I break up at any point. First question, Governor, I just wanted to clarify about the rollout to frontline essential workers and people with underlying conditions. I know that there had been some talk at one point about tiering that group, since it is going to be a fairly large group. Is that still on the table, or is that eligibility just going to be open to both of those groups completely at the same time?
We're going to be discussing this over the weekend. Look, Emily, here's the trade-off. You don't want so many people all suddenly with the option of getting the vaccine at the same time that you have some of the, crowds that you've seen in other situations, and people being put off to get their vaccination appointment for, weeks or months on end. By the same token, I think, Josh has convinced me that the group of essential workers is pretty narrow. Maybe it's 325,000 or so. We were able to handle that with a similar cohort for the 65 to 75-year-old and able to manage that pretty well over the course of a few weeks. So that plus the number of vaccines we get over the next couple of weeks will determine. But I think all the essential workers will have the doors open to them, I'd say within 10 days, 2 weeks.
And that applies to people with underlying conditions as well, right? Just to be clear.
For the people with underlying conditions, we were talking about, perhaps doctors reaching out to those who have the most severe conditions. But let me get back to you with more clarity on that first thing next week.
Okay. And then the other thing I wanted to ask about is just kind of more generally speaking, as the state expands to more and more people, it seems like automatically some focus would shift away from residents who are 75 plus to the people who are still the most vulnerable. So is that kind of what's happening right now? Like is the focus shifting away from the 32% of 75 plus year olds who are still out there? And can you talk a little bit in general about how the state is still making sure that those people are a priority?
Well, I'll start with this. I mean, I can tell you where our focus is not shifting away from. That's underserved populations that are the ones least likely to get vaccinated, either due to access, either due to hesitancy, making sure that we continue to be very proactive in reaching out to those communities. When it comes to, say, 75 and above, if there's 20 or 30% of them that haven't gotten vaccinated, we'll work with our healthcare providers to see if there are better ways that we can reach out to them, because they should be a priority. They're the most at risk.
And I know that before 75 plus year olds became eligible, the thinking was that that group would probably have a high percentage of vaccinations similar to what we saw among nursing home residents. So because we're only at 68% right now, and it seems to be slowing a bit, do you have any concern about the entire population getting to 80% vaccination rates that we need for herd immunity?
Right now, I think, Emily, the trend lines are pretty good. I mean, as you heard me say before, 30% of the nurses, the nursing homes and, the hospitals were only 30% wanted to get vaccinated in the first round. A few weeks later, it was up to 60 and 70%. We have more friends or friends of friends that get vaccinated. They feel pretty good. They feel more confident. So I think that'll be true of those communities, underserved communities, and even the over 75-year-olds. I think time will cure some of this.
All right. Thank you, Governor. Appreciate it.
Thanks.
Connecticut Public Media. the Day of New London.
Hi, Governor. You had mentioned at the beginning that there was this reverse call going out in Bridgeport where you could, press 2 to set up an appointment. Is that just for Bridgeport? And if so, is that something you're looking at expanding to other cities and underserved communities?
Sounds good to me, but take it, Josh.
Yeah, no, many communities around the state are doing similar things, whether it's through their local health department, who've been doing such amazing work across the state. Many of the municipalities are jumping in there. We have senior centers. We have federally qualified health centers have been doing outbound phone banking like that. So there's an incredible set of activities going on across the state, a lot of creativity, a lot of very strong outreach, not just in Bridgeport, really across the state.
And then we just heard Andy Slavitt say, we shouldn't be taking too much comfort that we're out of the woods because we see cases dropping, and just because you can put 200 people in a room doesn't mean you need to put 200 people in a room. So, Governor, when you're talking about easing some of these restrictions in different ways, why now as opposed to kind of waiting to see cases continue dropping? And are you worried about the message that this sends?
No, I think it's the right time to do it. Look, why we can wait another few weeks. I think what we've done, Erica, has been, or Emily, has been pretty cautious as we've gone through this on a careful way. And I think you've seen as we can, we started reopening on May 20th, and for the next 6 months, our infection rates went down. Then we had to ramp it up a little bit again when you had that flu season. And now they've been going down for, well over a month. And I think when you have a 2% infection rate in some of these big, hockey rinks that are a little bit like an outdoor tent type arena, probably you can have up to 200 people if they keep the distance and they're wearing their masks. So I think it's an appropriate thing to do. And if we have to change gears again, we will. But I don't think we'll have to because of the vaccinations.
And then one more question on vaccinations. Can you just kind of clarify again how many doses we're getting this week, how many you expect next week and in future weeks, and then kind of how the federally qualified health center doses play into that?
Why don't you take that, Josh?
So just talking about first doses, we've received about 59,000 this week. We have access to 72,000 for next week. So the 22% increase that the governor mentioned on Tuesday. And then we're still waiting for clarity on how many doses will be coming on top from the federally qualified health center federal direct allocation and when that will start. Initially, we heard that might start next week. We've heard it may start the week after, so we're still waiting on some more details there. And then the second doses just follow however many first doses we got 3 or 4 weeks prior.
All right, thank you, everybody. I'm getting the signal from Max, and a special thanks to Andy Slavitt. I think it gives you a little bit of perspective on the nature of the relationships, the federal relationship, the state relationship, how we work with our hospitals, how we work with our frontline responders, and that's how we're getting through this together. So far, the trend lines are all going in the right direction in Connecticut and through most of the rest of the country as well. I think that gives us opportunity to cautiously reopen. I use the word cautiously. We'll know a lot more in 3 weeks than we know today, but we're doing a lot better than we were 3 weeks ago. Thanks, everybody.